What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, March 14th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there were a lot of viruses this winter that did make people sick. COVID is still out there. It's been ongoing since 2020, and in some cases, yes, some people did have COVID back in parts of 2019. So it's something that's still here. It's something that's not going away. So you need to be informed with what's going on with COVID, the latest variants, the latest data, cases, and of course all these other viruses as well. The best way to do that, subscribe to my channel down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Help me get to 10,000 subscribers by the end of this year. Already, we do have some news stories to talk about today. We're going to do a few news stories today. Then we're going to take a look at some new data as well. And we'll probably get to a lot more news stories tomorrow because I am actually holding back on some things that I saw pop up at the last minute. So we'll get to those tomorrow. But this is a very important thing to note. The measles outbreak in Texas. Yes, it continues to grow. It's now up to 259 with just 2 among fully vaccinated people. So get this, 259 cases, only 2 of them are fully vaccinated people. Yeah, that's not good. So this continues to grow. And it says here with 36 new cases reported over the last 3 days, according to data released on Friday. And I can report this. There is now another state being added. Kansas now joins the measles club. Yes, measles case has been confirmed in southwest Kansas. This is something that continues to worsen. We're seeing more and more states fill in. We saw Vermont added this week. We saw Florida last week. We saw another case on New York State this week. This time it's in Stevens County, Kansas. And it does not know if this is linked to any of the ongoing outbreaks. So we may start to be branching off into separate, okay, where did this case come from? Yeah, that's where we're at right now, like here in Philadelphia area. I don't believe that is connected to anything in Texas at this point, and we don't know if this is connected, so stay tuned. We'll just have to keep seeing if any new information pops up on it. Then we have this. This is another family tree that keeps growing as well. This is not good. 6th flu-related child death reported in Michigan. Yes, they're now up to 6. This is something that's not good. I think number 4 and 5 were just about a week or 2 ago. So, yeah, flu deaths, they are still happening, and they're still happening in children. Speaking of flu deaths still happening, North Carolina flu deaths are now near 400. The state has nearly 400 flu deaths this season, according to the latest statewide figures. The Department of Health and Humane Services said there were 34 new deaths reported last week, bringing the total so far this season to 396. Last season there were 319, and you know what? There will probably be more deaths in the weeks to come. So, yeah, this is not done yet. Flu season, it's still sticking on for a little bit. DHHS says most of those deaths continue to be people 65 years old and older, with 283 deaths. 79 were people between the ages of 50 and 64. 30 were between 25 and 49. 2 between 18 and 24. And 2 were between 5 and 17 years old. Now we move on to this in South Carolina. South Carolina is getting hit with high flu deaths, hospitalizations, even as spring nears. Some counties are still struggling big time. There were 23 influenza-associated deaths reported the week of March 2nd to March 8th. Yes, those deaths in South Carolina for flu, they are still happening. The report notes that 11 of those deaths happened in previous weeks, so there were a little bit of a backlog. Get this, the state has had 391 associated hospitalizations, flu-associated hospitalizations reported by 63 hospitals the week of March 2nd. Over the same week a year ago, there were 65 associated hospitalizations reported by 50 hospitals. So there were less hospitals reporting last year, but at the same time, the number is up. There have been 7,450 hospitalizations this season so far, compared to 4,507 last season at this time. So that is not good whatsoever. Then we move over to Arkansas, which is still seeing a rise in school absenteeism as flu and COVID-19 cases impact public health. And if we scroll down here, we do learn that this season, Arkansas has reported 126 influenza-related deaths, including 3 pediatric deaths, with 78.6 of those not vaccinated. That's a high number, not vaccinated. And they had 11 COVID-19 related deaths reported this week. Last year, they had a total of 532. And it looks like so far this year, they're already at 96 COVID-19 related deaths. And 46 influenza outbreaks have been reported this season with flu from nursing homes or other big settings. Bird flu now. In Westborough, Massachusetts, bird flu is suspected in the death of 6 swans. Yes, this is in Westborough, Massachusetts. We've been seeing various different animals, various different types of birds getting impacted by this. This is something that is really bad and something that we definitely need to be taking serious, because we continue to see these random little outbreaks of birds that find to be dead, and then they end up testing positive. Yeah, it's not a good thing. All right, tomorrow is International Long COVID Awareness Day, March 15, 2025. And yes, we will have some long COVID related content within tomorrow's virus update. I don't know how much time we'll spend on it, though. I can already tell you tomorrow is going to be a very busy virus update. We'll probably go at or over 25 minutes tomorrow. The wastewater viral activity level for COVID-19 in Canada is moderate. Flu A is moderate. Flu B is moderate. And this is a change. RSV is now listed at high levels up in Canada. Yes, high levels of RSV there. So that is not a good thing. Not much to show you on the website. Let's see if there's any thing that's been posted this afternoon that needs to be shown. No, because I already showed you the measles update. I am going to be doing some updates to some of my tracking threads either tonight or at some point over the weekend, or maybe multiple times this weekend, because some of them are way behind. I do have a whole browser listed of things that just need to be archived onto the website, and I intend to get at some of that today, and I'm sure I'll probably find more news stories and fall behind again at some point. But yes, that is very important that I get to that, because that's what my website is. It is really an archive. Now, I have to show you air quality values. I don't have the Storm Prediction Center up. I should. If you're anywhere in the Mid-South, we're talking weather for a second. If you're anywhere in the Mid-South, say Mississippi, Alabama, Arkansas, Louisiana, even more north, we'll include portions of the Midwest, please, today and tomorrow, be weather aware. If you have a weather radio, please make sure it has batteries. Make sure it's at the ready to go. There is a significant storm outbreak that is going to happen over the next 2 days. The Storm Prediction Center has actually gone with a high risk for day 2 in portions of Alabama and Mississippi. That means tornadoes are likely. Some could be strong. Some could be violent. Winds are likely. Hail's likely. Yes, you need to take this seriously, and the threat of storms down there is real. I just wanted to get that in there. Incidentally, in those same areas, air quality is not the best right. Look at Texas. Yeah, we're seeing some oranges show up there. We're also seeing some oranges show up in the Carolinas. They'll be on Sunday. There'll be a severe weather threat along the Carolinas, and maybe even up into here in Pennsylvania as well. So an active next few days when it comes to the weather front. Please take that seriously. Maybe I will remember tomorrow to show the high-risk area, because I'm sure it's going to stay there. This looks to be one of those classic severe weather outbreaks this weekend. California has some minor air quality problems as well. Taking a look at what's going on with allergies, and I do need to refresh this. Look at this. The Reds. They've made their way a little bit further to the north. Ohio Valley, Indiana. Yes, you're now starting to enter the reds, and some of those oranges are there as well. Yellows up into New York State, even into Massachusetts. And on the West Coast, we do see some reds showing up in Nevada, also portions of California and Arizona, just to the northwest of Phoenix. Problems in Colorado as well. So if you're one that has allergy problems, time to start taking that allergy medicine. Taking a look at what's going on in Florida, and let's refresh this. Wow, a lot of calls for fall. How many are there? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 calls for fall at this time. Sick person is showing up a few times as well. Not good to see that many calls. In Philadelphia yesterday, that was Pinellas County, Florida, by the way. In Philadelphia yesterday, 783 EMS incidents were reported. Taking a look at what's going on right now with Montgomery County, just outside of Philadelphia. This is a live look-in at the CAD, computer-aided dispatch, and we do see there are several calls going on. How many? 14 at this time. Yeah, that's about right for this time of day on a Friday. Taking a look at what's going on in Chester County, we do see a few sick person calls, cardiac arrest. That's never a good thing. And some other things going on at this time. Taking a look at what's going on with the hospitals in Pennsylvania as I refresh this, and hopefully WellSpan Gettysburg update. It did. And it looks like there's a STEMI, STEMI diversion at this time. Taking a look at what's going up near Pottsville, Pennsylvania. Emergency department overcrowding. Lehigh Valley has several hospitals with problem, and just one. It looks like Paoli Hospital, which is Mainline Health, that is dealing with overcrowded at this time. Over in New Jersey, we need to refresh this to make sure it is updated. And we can see in New Jersey, we do see some hospitals dealing with problems at this time. Divert looks to be a thing at some of these hospitals, and there are a few other hospitals listed. The one looks like it has the helipad down. St. Joseph's University Medical Center, their helipad is currently down at this time. Okay. Taking a look at Walgreens this week, the positivity rate for COVID was 13.2%. When we take a look at flu, we do see flu this week for flu A and flu B was at 3.96%. And if we look really closely here, flu B was actually rising slightly at Walgreens this week. In New York State, cases, they're pretty close to what they reported yesterday. Again, this is a rise over last week for these last couple of days. And you can see that here when you take a look at the blue line, which is the average, and it's gone up a little bit. 1,306 new cases. That may be from New York State. I'm hearing the positivity rate in New York State is starting to creep upward. I will do some investigating on that. Taking a look at this, before we take a look at the statewide level, I had it here to New York City. Let's show you that first. Yeah, New York City's hospitalizations from yesterday went up by 10 to 322. And 32 people in the ICU in New York State. Now let's take a look at that statewide level. And we can see here that even the statewide hospitalizations, they did go up slightly. 731 and 68 people in the ICU. Let's also take a look at the hospital admissions real quickly. Yeah, a little bit of the 7-day average is showing a little bit of an increase, but I'm not terribly concerned just yet. Just something to keep an eye on. In the back of our mind that, hey, New York State, the cases went up a little bit. Let's keep our eyes on it. Nothing to be too alarmed about just yet. I don't think it's going to a wave. We won't know for a couple. It usually takes a week or two for us to figure out if it could be going to a new wave. Alrighty. Speaking of a new, we do have an update, and I need to refresh this because it's not loading for some reason. This is the new variant proportion update, and there it is. LP.8.1 is now up to 47% of all cases in the United States. Yeah, it is trying to clear the board. XCC is still 26%. KP 3.1.1 is at 5%. That's an old variant from last summer. MC.10.1, 4%. LF.7 is at 4%. MC.28.1 is at 3%. LBE.1.3.1, 3%. That variant's a mouthful. And you can see there's a whole bunch of other ones. We're not seeing this BA.3 show up yet that many are talking about. I hope to get some more information on it. Maybe next week. I'll be looking to see what the people that are well more qualified than me. I'm just an independent reporter, but they're virologists that actually have degrees. If I see something that's really good and worth sharing, I will include that in a future update. All right, taking a look at this. Emergency department visits when it comes to COVID. We can see here they are dropping at this time. We're not going to go state by state today. We'll probably do that, I don't know, maybe Sunday or Monday. Depends on how much news there is on Sunday. Definitely not tomorrow because, like I said, there's going to be a lot to go through tomorrow, especially with it being International Long COVID Awareness. Taking a look at what's going on with hospital capacity in the United States, and we can see here that the number of percent of beds being used in the United States did drop from 76.2% 74.3% down to 75.5%. That is a good thing. ICU beds being used also, that went down in percentage-wise to 73.3% at this time. And I suspect we should take a look real quickly at what's going on in Washington State. Remember the other day, I think it might have been yesterday, we saw Washington State was oh so concerning. And take a look at this. It is now starting to drop. Still 85.7% of inpatient beds being used. That's still pretty bad. We need that number to come down further. And it looks like they are known to have this problem. You can see here, if you just go back, all the way back into 2023, it's constantly over 80%. So that's something that is not good. Taking a look at this, wastewater activity when it comes to COVID at this time. We can see that this week, for the most part, nationally has dropped, and as still is dropping in the Midwest as well. You can see that orangish line right here. If we can, you can see that is dropping at this time. And when we take a look at the national level, once again, that is dropping. Taking a look at influenza A this week, and we can see that is listed at moderate, and that level is dropping as well. And when we go to RSV and wastewater this week, that does also continue to drop, which is some very good news. And we can see here the number of orange sites and red sites on the CDC map here, orange and red being high. That number continues to drop. There's still 191 orange sites, still 29 red sites at this time. We can see there's a few red sites still in Texas that are showing up. That's relatively concerning. But overall, again, things continue to improve, and they are not terrible at this point. When we take a look at epidemic stats, let's do COVID first. Likely growing now in North Carolina, Mississippi, Louisiana, and also in Oklahoma. And we are now at growing status in portions of Alaska. So that's new this week. And then there's a lot of places that are likely declining, not estimated, or not changing at all. When we come down to flu for epidemic status, we do see likely declining and declining showing up in many states. We don't see anywhere that's growing or likely growing, and anything else would be not changing or not estimated at this time. All right, here's the update to the influenza-like illness map. And we can see here New York State is reporting once again, and it's still coming in at very high levels. You can see it's at the lower tier of very high. Also very high still is Maine. Also Ohio, Michigan, Louisiana, and New Mexico. We do see that no longer listed at very high. This is good news. It's finally South Carolina. However, they are still in the high category, as is New Hampshire, Massachusetts, Washington, D.C., Tennessee, Indiana, and also up in Washington as well. And I do believe, what's Oregon listed at? Yeah, Oregon's still listed at high too. And you can also see Kansas is still listed in the high category. And then there are some other states that are in lower shades of high, and still some moderate states out there as well. All right, getting to some things that we did not get to yesterday. And first off, that is Ohio. And we do want to see Ohio's update for this week, if it ever loads. Sometimes this website, it just spins in circles and takes a long time to load. There we go. We do have Ohio. And Ohio has 2,943 new cases this week. That's down. That's down. That's a good thing. Down from 3,110. Didn't drop as much as the previous week's decrease, but hey, down is good. And look at the hospitalizations. Yes, they're steadily declining now. 121 were added to their grand total of 158,554. 3-week trend for ICU admissions, just 4 were added. And deaths, 34 deaths were added to their grand total of 44,932 deaths. Probably before March ends, or maybe at some point in April, they're going to hit a grand total of 45,000 deaths in Ohio. Yeah, unfortunately, that milestone is coming soon for the state of Ohio. When we take a look at New Jersey's respiratory dashboard, we do see here that the positivity rate for flu is dropping. 3% positivity rate. COVID is 0.8%. That is not rising. And when it comes to when it comes to RSV, that positivity rate is very low. It is just 0.1%. Very good to report that things are dropping in New Jersey. And you know where else things are dropping? For the most part, things are dropping in Colorado. COVID-19 hospital admission count, 63. Influenza, 218 still. That's down by 75, but still dropping. RSV at this time, 168, still dropping. Weekly diagnosed emergency department visits, That's all dropping. Influenza, still 1.93% of the visits. The positivity rate for COVID went up by 0.5%, up to 2.87%. Not concerned about that yet. If it was going up for multiple weeks, then we would start to get concerned. Influenza, it's still at 12.5% positivity rate. RSV is still at 9.6%. Both of those, however, did drop at this time. And we can see here, activity in Washington State, when we take a look here, we can see that is continuing to drop. Hospital admissions are dropping. We can see overall, everything, for the most part, is dropping in Washington State at this time, which is some good news. Alrighty, folks, that does it for the Friday edition of the Virus Update. We will have another update again tomorrow. Tomorrow's will likely be a very busy Saturday Virus Update. Whatever news I find, I'm sure we're going to have some data. We're also going to talk about long COVID tomorrow. So yeah, we have a lot of things to go over tomorrow. If you enjoyed today's video, give it a thumbs up. Hit that notification bell. Subscribe if you're new down below. And, of course, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Friday evening. Thanks for watching.